Hi, my name is Dr. David Lee, physical therapist, and I'm going to be going over some stretches to help relieve and prevent shin splints. So I'm going to go over some of the muscles here in the lower leg that can give you shin splint type symptoms. So basically, if we start at the shin bone here, the first muscle here is called your tibialis anterior, and then you have your extensor digitorum longus, and then you have your peroneus longus. And then if we wrap to the back, you have your gastroc, which is your calf muscle, and then your soleus underneath of that. And then on the inside here, we have your tibialis posterior, your flexor digitorum longus, and your flexor hallucis longus. So if those guys get really locked up on you, they can cause shin splint type symptoms. This is the Achilles stretch. What we're going to do is we're going to use the calf stretcher for this Achilles stretch. So make sure that you're actually able to hold on to something, a wall, chair, anything like that for balance. So we're gonna go ahead and step inside of this guy. And what we're gonna do is we wanna make sure that our toes are nice and spread, gives us a little more balance. So from here, we also wanna make sure that our foot is flat. So don't let your foot come out to the side. So flatten out your foot. And then from here, we want to make sure that when we rock back, we are squeezing our knees tight. So we want to make sure that we're sturdy from the legs. And then you're just going to rock back onto the heel here. And you should feel a nice stretch in the calf and then the Achilles as well. So you can hold that for about 30 seconds to a minute. And then you can rock forward to take the tension off. And then you can rock back into that. Make sure that your feet are flat. Make sure that your knees are tight. Make sure that you're nice and upright through the chest. Hold that for about 30 seconds to a minute. And then rock back. This is your standing calf stretch. What we're going to do is we're going to use the wall or a chair for this one. Okay, we're going to bring the leg that you want to stretch backwards. And you're going to go ahead and squeeze the knee tight. And then what you're going to do is put the weight into the front leg. Make sure that the leg is completely straight in the back, and you'll feel one of your calf muscle called your gastroc stretching out. So you're going to hold that for about 30 seconds to a minute. If you want to get the other calf muscle, which is called the soleus, you need to make sure that the knee is bent, and you should feel a little bit of a lower stretch there. So you're going to hold that for about 30 seconds to a minute as well too. And then you can do about 3 to 4 sets of that, and it should feel like it's loosening up. This is your standing tibialis posterior stretch. What we're going to do is we're going to go ahead and use the chair for this one. You can go ahead and use a wall to hang on for balance. So what we're going to do is you're going to get into your calf stretch, one leg in front, the affected leg in the back here. And what you're going to do is keep the whole foot down the ground, bend the knee. And what you're going to do from here is you're going to turn the knee towards the other knee. So you're going to bring your knee in. If you have any knee issues, please refrain from doing this if the pain starts to get worse. What we're going to do from here is you're going to go ahead and get into that lunge position. Keep the foot down, and then you're going to turn the knee in. You should feel this working on the inside of the lower leg here. So you're going to hold it for about 30 seconds to a minute, and then release and do about 3 to 4 sets of that. This is the standing tibialis anterior stretch. What we're going to do is you're going to use either a wall or a chair you can hold on to. So from here, you're going to bring the affected leg back, the one that you want to stretch out. And then what you're going to do is put the top of the foot on towards the ground like that. Make sure that your toes are nice and straight. So from here, what we're going to do is we're going to bend the front knee and we're going to drop into the stretch. You should feel that all the way throughout the front of the shin. And then you're just going to drop here for about 30 seconds to a minute. The further you drop down, the more stretch you're going to feel. So do about 3 to 4 sets of that, and you should feel that loosen up. All right, and those were some stretches to help relieve symptoms and prevent shin splints. If your symptoms continue to persist, please consult your medical professional.